I'm Kate Kerr, I'm the Director of Research at HaemNet, and prior to this role was a haemophilia nurse consultant at Greater Ormond Street Hospital for Children in London. So thank you for inviting me to give you this talk, which is about the Cinderella Study. So in background to the Cinderella Study, we know that women with inherited bleeding disorders are underrepresented within haemophilia care, haemophilia studies and haemophilia outcomes. And back in 2016, the James Lind Alliance Priority Setting Partnership for Bleeding Disorders, otherwise known as #StopTheBleeding, was established. And that brought together healthcare providers, patients and others who were interested in women who bleed for whatever reason. So surgeons, people from the haemophilia community and people from the ITP community. And through a process over about a year, from 500 questions submitted by healthcare professionals and people who were affected with bleeding, the top 10 priorities for further research into bleeding in women were identified. And you can see here that the fourth one was how should heavy periods be managed in women with bleeding disorders. And that led to the Cinderella Study. So we wanted to talk to women who have bleeding disorders across whatever their diagnosis was, to understand their bleeding symptoms and how they were treated and whether their bleeding impacted significantly or not on their lifestyle. So we wanted to hear from women who had a diagnosed bleeding disorder, so from my background within haemophilia, as well as those with ITP, women who had a relative who was diagnosed with a bleeding disorder, which might impact on them, so women who were haemophilia carriers, and also women who had daughters who were haemophilia carriers. We used a mixed methods research model to attract these ladies. So we first did an online survey, which was promoted through social media, designed to capture the range of women's experiences of their bleeding. And as the final question in that survey, women were given the opportunity to give us their email addresses so that they could participate in a Zoom-based qualitative focus group or interview. So these first few slides are just data from the whole group, and you can see here that we got a lot of responses. So 280 ladies replied. The largest number of those were people who were haemophilia carriers of either haemophilia A or B, with or without low levels themselves. But the second largest group were ladies with ITP, with 58 of them. And you can see there was also a bunch of ladies with rarer bleeding disorders as well. To facilitate the analysis, we've divided the ladies into three groups. So ladies who carry haemophilia, A or B, regardless of their level, women who have a diagnosed inherited bleeding disorder, and then the bunch of ladies who had ITP. And we'll talk more about those in the later slides. Again, looking at the whole group, you can see that we had a wide age range of participants, so from people aged less than 16 to people aged over 70. That they were all relatively well educated and the majority were employed. So there were some who were parents or homemakers, some unemployed and some retired, but the vast majority were able to work, which is positive regardless of their bleeding disorder. So when we turn to think about the impact of bleeding on these ladies, we can see here that the symptoms experienced were, as you would expect, given the age range that we had, lots around heavy periods and childbirth. But for the ladies with ITP, and you can see them here in the orange bars, although the absolute numbers don't look very different, statistically they reported more bruising, more gum and mouth bleeding, more prolonged and excessive bleeding after childbirth and after surgery than did the ladies with either haemophilia carriers or inherited bleeding disorders. Conversely, though, they reported less impact on time lost from school or work than did those who had the inherited bleeding disorders, and less impact on activities. So they reported that they were able to go out socialising, go to meetings, and having ITP did not really impact on them being able to get a job or in further education. So that was the results of the quantitative study, and in the qualitative study we invited various participants to undertake a interview with us by Zoom, and we ended up having 13 ladies who did that, so 6 who were haemophilia carriers, 4 who had other bleeding disorders and 3 who had ITP. Now, you might think those numbers are relatively small, and in fact they are, but within qualitative research, that is a good number of people to get into a study. So each interview was recorded and then transcribed verbatim and analysed using NVivo, which is a qualitative research tool which picks out words, phrases and themes. All of the participants were anonymised, and we're going to show you some direct quotes later, and you won't be able to see who those ladies are because they are anonymised. And then after the initial coding, all of the codes were refined and organised into common themes in a framework, which is standard qualitative research methodology. So on this slide, we've gone back to the whole population again, and you can see that there are challenges and facilitators to being a woman with a bleeding disorder and how you manage to live your life. If we look at the challenges on the left-hand side, you can see that there are some that are institutional, and sadly, they include a lot about healthcare professionals' lack of awareness and competence in managing those ladies and their bleeding disorders, and even more sadly, a lack of compassion and empathy from us as healthcare providers to them as people who are affected. But conversely, we also see as a facilitator that support from family and friends and compassionate doctors and healthcare professionals is a thing that is reported by some as being good and something that supports them throughout their diagnosis and treatment. The personal society challenges are the impact on day-to-day routine, a lack of awareness of the condition, not necessarily from healthcare professionals, but from others in the community, the stress and anxiety and uncertainty that that causes, and for some not knowing what is normal. And they used the word normal, we didn't. And for them to cope with those, they need a good internal coping strategy, and that includes having a strong mindset, accepting and facing the situation that they find themselves in, networking and socialising with others, and one lady we'll talk about later said that this was the first time that she'd talked to anybody else with ITP and how helpful she'd found that. Being able to educate others about their condition and being insistent and inquisitive about their condition and their treatment, and being able to undertake their own research to make sure they were getting the best treatment available. So I'm now going to just focus in the next few slides on what the women with ITP told us in their interviews. And we're going to go back to those institutional challenges, the challenges and the facilitators that I just had in the overall slides. So here, I'm not going to read all of these slides, you can do that. We can see that in the institutional challenges, a lot of what came up was that people didn't understand much or anything about ITP, so that the ladies went to appointments and the doctor or the healthcare professional either admitted to not knowing what ITP was or looked it up in front of the ladies and said that they didn't really know what they were doing, and that obviously didn't instill great confidence into the ladies. And there were some who said that actually they felt like they were on a little bit of a conveyor belt. So we do this, and if that doesn't work, we do that. It didn't feel like it was very individualised to the particular lady of the treatment that they were having. And then again, that nobody really understands. So nobody really understood the impact of ITP on the other things that might be happening to these ladies. So if they needed surgery or if they needed dental care, what were the impacts of that on them having their ITP? The personal challenges focused very much on the personal and professional life, education and day-to-day routines of these ladies. Some said now that they were older, they realised that back in their earlier womanhood, they'd had very bad periods. And actually this lady here said that because she'd had a premature menopause, that was no longer an issue for her. But when she was younger, she would hope that her mum didn't wrap her in cotton wool and allowed her to on one hand, participate fully in school activities, but on the other, not to be able to be made to undertake physical activity and education because of that whole undressing and redressing and people seeing the bruising that she had. There's people who reported concern that was expressed to them about the kinds of bruising that they had, and an assumption that they must be in some way being abused, and how they were saying, I walked into the cupboard and people again didn't quite believe that story. And then the impact of doing unusual activities. So this lady here who tried windsurfing and said that she got such dreadful bruising from that that she wouldn't ever try it again. And this all comes back to that overall lack of awareness of the condition of ITP, so that not only was the doctor looking it up, but these ladies were going home and looking it up on a computer themselves. to find out what it was, what treatment they needed, and so that they could ensure then that they got the best care for themselves as they moved forwards. The big external facilitator was always support from family and friends. So although the lady said that she was wrapped in cotton wool by her mum, she understood why that was. She was young and had to be shielded a lot from the diagnosis, the treatment, and the implications of what that might mean long term. One lady said how important her husband was, and he was always her advocate when they went to hospital. And he was always the one who managed to do the first aid for her when she hurt herself at home. And one that said that she was offered not very much emotional support from doctors, but that she got her emotional support from family and friends, and that the doctors and the healthcare providers didn't offer very much of that. And I think that's something that we see also in ladies with inherited bleeding disorders, and something that we need to try to address. However, there are a couple of ladies who said that their doctors were very supportive, and that they did take the fear out of the diagnosis and treatment, and that they found that reassuring. And that was also said for nurses as well as for doctors, that they felt supported and understood. But of course, all of that meant that the ladies had themselves to have their own internal coping mechanisms and a mindset that was accepting in the face of the situation that they were in. So getting used to having the bruising and the bleeding and the very heavy periods. Living with your ITP and not worrying too much on what the number of your platelet count is, but making sure that you were able to live well with the platelet count that you had, and taking life one day at a time. And here's this comment from the lady who said, it's nice to talk to a fellow sufferer. I've never come across anybody with this condition before, so it's nice for me to hear what they have to say. And perhaps that's something we need to do in hospitals, is to address how we, despite all of the rules about confidentiality, manage to get people to meet others who are in a similar situation. And there was a whole theme about being insistent and inquisitive, so making sure that you ask the right questions, make the most of the knowledge that you have to become self-assured and self-motivated, and to make sure that you go back if you don't hear back from your hospital. So this lady said every 6 months she went and had her bloods done, and nobody ever came back and told her what the results were, and she then had to follow that up herself. And that is again something we could be much better at. So overall, the way forward from the participants in this study, and this is the ITP ladies as well as the ladies with inherited bleeding disorders, they said very similar things. So we need to involve and inform the patient, and they use the words the patient, much more than we do as healthcare professionals. We need to provide much more psychological support for the ladies so that they are feeling supported and listened to. That's really, really important. They felt that there should be more research into ITP, not just what causes it and how it's treated, but the implications of living with it long term and the psychological support needs that they had. That we should provide better networking opportunities within hospitals as well as within societies, both national and international. That we should be promoting a better consistency of care. So some ladies with ITP felt they had very good care, and some felt they had care that was not lacking but could be better, and that there should be much more raising the awareness of the condition. And I know that that's exactly what you're trying to do with this meeting this weekend as well. So that was my final slide, other than to say if you have any questions or you would like to contact us, then please do. We're available by phone, by email or via our website. Thank you very much for listening.